All right, today we're pulling back the curtain and looking at something you won't find in most textbooks, the hidden art of modern surgery. We're talking about this incredible, delicate dance of technology and skill that happens through just a tiny little incision. Let's dive in.
I love this quote. It just perfectly captures what we're talking about with laparoscopic or, keyhole surgery. It's all about incredible precision, right? But it also hints at this hidden challenge, something you might not think about at first.
So here's the thing. In open surgery, the surgeon is looking right at their hands. Simple enough. But here, nope. They're staring at a monitor, and they're completely 100% dependent on the image that a tiny camera is feeding them from inside the patient. That separation, that's what makes this so unbelievably complex. It's not just hand-eye coordination anymore. It's more like eye-to-screen to hand coordination. A whole different ballgame.
Okay, so if the surgeon is the one trying to thread that impossibly small needle, who's holding the spectacles? Who's making sure that view is perfectly steady, crystal clear, and aimed at exactly the right spot?
It's the cameraman, the camera assistant. Honestly, this is the true unsung hero of the operating room. You talk to any senior surgeon and they'll tell you this person can literally make or break the case. And believe me, their job is anything but passive.
Yeah, you could say the most critical tool in the room is one you'll never see on the surgical tray. It's that invisible instrument, the camera. So let's really focus on the person behind it, because their job is this constant, dynamic dance of anticipation and precision.
Now, look at this list. This is so much more than just holding a camera still, right? A lens fogs up, the whole operation grinds to a halt. A sudden jerky movement, the surgeon gets totally disoriented. And, get this, even keeping the horizon level is critical. A tilted view is like trying to operate on a rocking boat. This is not a passive job. You have to know the surgery. You have to anticipate what the surgeon's going to do next before they even do it. So once the cameraman has that view locked in, nice and steady, the surgeon can finally get to work. But remember, they're not using their own hands directly. They're working with this whole set of long, specialized instruments. Let's take a look at the main players in this laparoscopic toolbox.
First up, we've got the graspers. Now, the fundamental technique here is all about a clear division of labor between the surgeon's two hands. Think about it like this. The non-dominant hand, the exposure hand, is there to set the stage. The dominant hand, the dissection hand, is the one that does all the critical action.
So what does that mean in practice? Well, the left-handed grasper is all about holding and pulling back tissue to give the surgeon a really clear view of what they're working on. For example, when they're taking out a gallbladder, a special fundus grasper literally tenses up the gallbladder. This exposes a supercritical area called Collat's triangle. That's where all the important plumbing is. Then, the right hand can go in and do its delicate work.
And for that delicate work, one of the surgeon's absolute go-to tools is the Maryland dissector. The name kind of gives you a hint about what it does, but it's way more subtle than just, cutting stuff.
See, the Maryland is designed to gently spread tissue apart. It teases layers open without actually damaging them. It's the perfect instrument for what surgeons call skeletonizing, which is just a cool way of saying they're carefully isolating vital things like a duct or an artery from all the tissue around them before they get clipped and cut.
All right, next up is the suction irrigation tool. Now, on the surface, its job seems pretty simple. Keep the area clean, suction out fluids, rinse things off. But in the hands of a really skilled surgeon, this thing is a total workhorse.
And this is where you really see the creativity and versatility you need in laparoscopic surgery. A simple cleaning tool, it suddenly becomes a blunt retractor to gently nudge tissue out of the way. In a really difficult case, it can even act as a dissector to carefully separate anatomical planes. It's basically the Swiss Army knife of the surgical toolbox.
Okay, so we've got the surgeon's instruments, and we've got the cameraman's view. Now let's see how these two worlds merge in the real art of camera control, where the hard science of optics meets the pure feel of an operation.
These 5 rules right here, they are the absolute bedrock of great camera work. It's a constant balancing act, right? You zoom in for the super fine, detailed work, you zoom out to get the big picture, and you always move slow and steady. But honestly, the most critical rule, the one you can never break, is number 3. Keep both of the surgeon's instruments in the frame at all times. The second you lose sight of an instrument tip, you're basically operating blind. It's that serious.
This slide really nails a key concept, something that's passed down from senior surgeons to residents. The camera has to adapt to what's happening.
For that meticulous, careful dissection, the view is up close and rock steady, almost like a microscope. But for bigger actions, like clipping something, the camera pulls back for a wide, smooth panoramic shot. A great cameraman just knows, instinctively, which phase of the operation they're in and adjusts the view without even being asked.
Okay, let's put it all together now. Because this stuff, this expert camera work, this precise handling of instruments, it isn't just about making the surgery look cool or go smoothly. It all serves the single most important goal in any OR, patient safety.
So in gallbladder surgery, for example, there's this non-negotiable safety checkpoint. It's called the critical view of safety. It's a very specific anatomical picture that the surgeon must achieve before a single cut or clip is made. There are no exceptions. And here's the kicker. Getting that view is flat out impossible without that perfect, seamless teamwork between the surgeon's hands and the cameraman's eyes.
And this is the really fascinating part. You're not going to find these skills, these little nuances of camera control, and how to feel your way through an operation in a standard textbook. This is what's called the hidden curriculum of surgery. It's the kind of wisdom that gets passed down from a mentor to a trainee over hundreds and hundreds of hours, standing side by side in the operating room.
Which kind of leaves us with this one last thought to chew on. We always praise the steady hands of the surgeon, and of course we should. But in this world of laparoscopic surgery, where the surgeon's ability to even see depends entirely on someone else, you have to wonder, is the steadiest hand in the room the surgeon's, or is it the cameraman's?